21 studies explored a change in menstrual cramping or pain post-COVID vaccination. Several studies found a significant increase in the percentage of people experiencing more pain between cycles compared to before vaccination. Pfizer-BioNTech vaccines showed a 4.3-fold increase in worse pain with periods and a 5.5-fold increase in overall symptom worsening in women with endometriosis after this vaccination compared to controls who either didn't receive a vaccination or received a different type of vaccination. We are now a few years out of the COVID madness, but far enough out that helpful research is starting to emerge on the COVID vaccine and its effects on menstrual changes, pain, fertility, and AMH. So let's unpack it. This video is not a reflection of my personal experience or views on the COVID vaccine, but an objective review of the available research. If you haven't already, please give this video a like, share it with a friend, and hit that subscribe button. Have you or someone you know experienced changes in the heaviness or timeliness of your period post-COVID vaccination? Let's start with an overview on the available research about the COVID vaccine and menstrual cycle changes. At a glance, the available research shows that when the COVID vaccine was administered in the follicular phase, so that's the phase between the end of the period and just before ovulation, it extended the length of the menstrual cycle by an average of 1 day. Additionally, those women vaccinated in the follicular phase were more likely to experience a longer bleeding window compared to those who were vaccinated in the luteal phase or who remained unvaccinated. Another study confirmed vaccination was shown to increase the length of bleeding time by 1.3 to 2.3 days in study participants. One study showed that 8% of the vaccinated individuals experienced prolonged bleeding lasting for more than 2 weeks. Contrary to these results, a 2022 study including 3,959 individuals showed no change in bleeding length or cycle length post-COVID vaccination. This systemic review included a review of 61 studies, and almost all found a higher percentage of at least one menstrual disorder in the first cycle after different types of COVID-19 vaccinations and after different doses. Menstrual disorders included changes in cycle length, changes in the amount of bleeding, menses length, changes in the experience of premenstrual pain, and breakthrough bleeding in this review. General findings of this review include that changes in menstrual cycle length was the most frequently reported change. 9% in one particular study experienced longer cycles and 7% reported shorter cycles. The absence or infrequency of menstruation was reported in 33% of people from a sample size of 24,090. One study found the length between periods in girls aged 12 to 15 years of age was longer post-COVID vaccination, whereas another found the length of time between periods was shorter in girls aged 14 to 15. This same review showed that most studies found a higher percentage of people reporting that their next period was heavier than normal after receiving the first and/or second dose of the COVID vaccine. Most of the studies also reported that the menstrual flow returned back to normal in several months, while only one specifically reported the changes in flow lasting 5 months. Pfizer and Moderna vaccinations were most associated with heavier bleeding. This study, including 4,610 cases, showed that the risk of hospital care for heavy menstrual bleeding was increased in vaccinated women, specifically in those who received their last dose in the previous 1 to 3 months at the time that this data was collected. This study showed new onset menstrual dysregulation following vaccination for COVID-19 in 20.6% of participants. Menstrual patterns were reported to go back to normal in 59.6% of vaccinated women. In women with endometriosis specifically, menstrual associated changes were reported, but not at increased rates compared to women without endometriosis. Pain and fatigue were reported more frequently in women with endometriosis in the first cycle post-vaccination, and menstrual headaches and fatigue were more frequently reported by women with endo in the second cycle post-vaccination. Patients on hormone therapy reported fewer changes in menstrual symptoms in the first and second cycles after vaccination compared to those who did not take hormone therapies. And by hormone therapies here, I'm referring to things like birth control or hormonal suppressants like Orilissa. Lastly, after the second dose of a COVID vaccination, there was an association with more than twice the odds of experiencing an early period compared to people without endometriosis. So that data is also specifically in people with endo. So now let's move to a conversation about premenstrual pain symptoms and the COVID vaccination. In the same review previously discussed in this video, 21 studies explored a change in menstrual cramping or pain post-COVID vaccination. Several studies found a significant increase in the percentage of people experiencing more pain between cycles compared to before vaccination. Stronger period pain was reported in girls aged 14 to 15 in one study. 2 studies observed no change in the intensity of pain, and one found that 11% of participants reported a decrease in the severity of pain. In endometriosis patients specifically, contracting COVID was a risk for worse pain with menstruation. Pfizer-BioNTech vaccines showed a 4.3-fold increase in worse pain with periods and a 5.5-fold increase in overall symptom worsening in women with endometriosis after this vaccination compared to controls who either didn't receive a vaccination or received a different type of vaccination. So now let's discuss vaccination and breakthrough bleeding. So again, in the same review discussed previously in this video, 18 studies looked at the association between the COVID vaccine and breakthrough bleeding, spotting, postmenopausal bleeding, and premenopausal bleeding. A large population-based study, including 2,587 Swedish women, found the highest risk for postmenopausal bleeding after a third vaccine injection. And a collection of studies with varying sample sizes did find reports of abnormal bleeding patterns as well. The percentage of reported abnormal bleeding patterns varied from as few as 1% of participants reporting abnormal bleeding patterns to 19% reporting abnormal bleeding patterns. One study did find that 66% of postmenopausal women experienced breakthrough bleeding. Let's now switch to a focus on fertility and AMH. Does the COVID vaccine affect AMH levels and/or fertility? This small study, including 129 women who received 2 COVID vaccinations, showed no change in AMH post-COVID vaccination. In a study including 2,733 eligible women, the incidence of clinical pregnancy and live birth were lower in the vaccinated group than the unvaccinated group, but specifically via a frozen thawed embryo transfer. Specifically, 56.6% of vaccinated women achieved a clinical pregnancy versus 63.6% in the unvaccinated group, and 44.3% achieved a live birth in the vaccinated group versus 52.2% in the unvaccinated group. These differences were also observed and more significant when the women were vaccinated before ovarian stimulation. This study showed no change in the probability of becoming pregnant in women vaccinated for COVID-19 or infected with COVID-19, whereas a transient decline in the probability of impregnating a female partner was observed in men infected with COVID-19. The study showed a steady decline of serum AMH levels until 6 months post-baseline. The levels were reported to increase at 9 months post-baseline. Now let's switch gears to talking about a sensitive topic. This systemic review and meta-analysis included 21 studies, 5 randomized controlled trials, and 16 observational studies reporting on 149,685 women, and it showed that the pooled rate of miscarriage among women who received a COVID-19 vaccine was 9%. When compared to placebo or unvaccinated women, the vaccine did not result in a higher risk of miscarriage. Of importance to note, the study was limited to observational evidence with varied reporting and high risk of bias, which may limit the generalizability and confidence in the findings. So now that we have sort of a nice overview of some of these findings, why did some of these changes post-COVID vaccination result? Based on the research summarized here, we can see that there is a general pattern towards more pain and menstrual irregularities, but why? The COVID vaccine is believed to cause a temporary activation of the immune system. This immune activation can affect immune cells within the uterine lining, contributing to abnormalities in bleeding patterns or pain. Fever, immune activation, or perceived stress brought on by the COVID vaccine could also affect the brain pituitary ovary axis, causing disruptions in menstruation or cycle length. One study did show that the COVID vaccine can have some undesirable effects in people with pre-existing conditions. Because people with endometriosis already live with more inflammation and immune dysfunction, this could explain the higher pain response or heightened fatigue and menstrual migraines seen in the research in endometriosis endometriosis patients specifically. So to summarize, most research to date does show a change in the menstrual cycle length anywhere from 1 to 2.3 days post-COVID vaccination. Change in menstrual cycle length, so specifically the length of the cycle from cycle day 1 of your period to cycle day 1 of the following period, was the most common menstrual disorder reported post-COVID vaccination across all of the research available. Pfizer and Moderna vaccinations were most associated with heavier bleeding. The Pfizer-BioNTech vaccines showed a 4.3-fold increase in worse pain with periods and a 5.5-fold increase in overall symptom worsening in women with endometriosis. Young girls aged 14 to 15 experienced the most significant change in period-related pain following vaccination. The absence or infrequency of menstruation was a commonly reported effect of the COVID vaccine. 33% of people from a sample size of 24,090, so that's just under 8,000 people in this sample size, reported the side effect in one study. Vaccinations administered more than 90 days prior to ovarian stimulation might be a better time to mitigate potential adverse effects on IVF outcomes, specifically a decline in clinical pregnancy and live birth rate. We observed only a slight short-lived decline in male fertility post-COVID infection, and in general, AMH was not seen to decline post-COVID vaccination, and the risk of miscarriage also did not increase post-vaccination based on the available research. Some symptoms like pain, fatigue, and menstrual headaches were worse in endometriosis patients than non-endometriosis patients. If you are someone who has had the COVID vaccination, what has your experience been? Do you resonate with any of the objective data from the COVID-19 vaccine research? Is there a specific type of investigation you wish received more attention? I'd love to hear your thoughts in the comments below. Thanks for watching today's video. If you found this video helpful, please give it a like, hit that subscribe button, and I'll see you in the next video.